Sheffield Live 93.2 FM, and this show is Communities Live with me, Andrew Tildesley.
And me, Susie Casson.
And joining us in the studio is Gerda Pohl from Phase Worldwide.
Hello, thanks for having me.
Hello Gerda, thanks for coming in. So first of all, please can you tell us a little about Phase?
Yeah, so PHASE is an acronym that stands for Practical Help Achieving Self-Empowerment, which is a little bit of a mouthful, but it does say what we want to do, which is helping people who really have no power to control their lives by giving them some practical help. But it is mostly about work in remote communities in Nepal. So it started as a group of friends 10 years ago who all had some experience and knowledge of Nepal, including some very experienced Nepali development workers. And we started a UK charity really to help raise funds to do some work that they want to do in very remote communities. It's quite a small group then, all volunteers. And over the 10 years, it's grown into a charity that now does quite significant work in Nepal and helps organizations like, UK Aid, DFID, and Big Lottery Fund to channel funds into communities that really need the support. We work in some of the probably most remote areas of the world where you have to walk for 3 or 4 days to get from the nearest road. So just no transport, no access, communities that really have no support from outside.
Great. So the annual conference is coming up on Saturday of Phase. Can you tell us a bit about that, please?
Yeah, so for the last 4 years, we've always tried to have an annual conference that brings together supporters from the UK with some of the key people working in Nepal, so that all the people in this country who are supporting the work of the charity through donations and events and technical skills can come together and meet the people who are involved closely with the work on the ground, just so that we can keep people engaged and let them know what's going on and showcase our work a little bit.
Fantastic. So that's going to be in Hillsborough on Saturday.
Yes, that's right. We're in the Burton Street Foundation. That's actually a new venue for us. Up to now, we'd always been out in Derbyshire in a youth hostel, which was lovely but more difficult to access for people. So this year, for first time, we've got it in a more accessible place.
Great. And can anyone come along to the conference?
Yes, in principle, although they would have to register beforehand because there are sort of limited spaces, and we still have some spaces free, though. So if people were interested, they could just contact info@phaseworldwide.org to get a space.
Great. So that's on Saturday. And is there a cost to attending?
We just need to recover the costs of renting the venue, which is approximately £15 per person.
Great. So if someone was considering coming along to the conference on Saturday, that would be a good introduction to the work of Phase.
It would be a brilliant introduction because we've got a team of the Nepal direct frontline workers. So we've got a couple of our health workers who work in remote communities in Nepal, and we've got one of the teacher trainers who works with teachers and children in the schools that we support, and we've got our executive director and programs manager both there, and myself, I'm also actually based in Nepal, so this is one of the 1 or 2 times a year that I come to the UK to contact, build the contact with the supporters here.
Great. So you're going to be speaking at the conference. What are you going to be talking about?
Yeah, so mostly about what's happening in Nepal on the ground at the moment. Obviously, we've had huge changes in the last year with trying to respond to the earthquake and that. But our work in remote communities is ongoing in pretty much the same way as before. We've just sort of added some recovery work. But I'll be talking about how things are for the organization in Nepal, how things are for our target communities, and more specifically about family planning and healthy reproductive lives for our target communities.
Great. So it sounds like a good opportunity for you to stand back and assess what you do in your daily life in Nepal.
It could be if the schedule wasn't quite so tight here. But no, the annual conference is a great opportunity to sort of reflect and talk to people about what we do. Yes.
Great. So how did you become involved with Phase?
Well, I'm part of the original group of friends that founded the organization. I'd just come back from 3 years volunteering in Nepal for a different organization, and then I had friends who'd been supporting that work and who wanted to get involved. And I had Nepali friends who we knew were able to actually do the work on the ground, because in the end you can't just send money to a country. You have to have people there who actually know how that money is best used to support people who really need the support. So having a couple of really experienced Nepali people who knew how to do that was really the catalyst for setting up Phase.
Great. So as a GP working in Nepal, what is a normal working day like for you?
Yeah, so I was a GP in South Yorkshire for about 9 years before I went back to Nepal, or settle in Nepal. I now work for a hospital in Kathmandu that is a travel medicine clinic, really. So we see a lot of travelers and a lot of expatriate residents. But I work for that clinic about 3 to 4 days a week, and then I work with the team in Phase as well. So a normal working day could be anything from seeing patients in the hospital to actually staring at spreadsheets all day, because that's a side of charity work that isn't talked about much, but we need to look at budgets and figures, and I do quite a bit of that as well. And of course meetings and working with our staff and doing trainings, and so there is no normal really.
Great. So over the years you've been in Nepal, what are the main changes you've seen?
So that depends a bit of whether you talk changes in the country or changes that our charity has achieved, because the country, of course, has gone through huge changes in the last 10 years. The Maoist insurgency finished, the royalty was deposed, and they're now a democracy. They have a constitution now. There's increased investment by the government in health and education services, but then there's been the earthquake last year. But from the point of view of what Phase has seen as changes in our project areas, there's areas where there was no functioning school, where children now go to school, areas where children were going to school but not to the 10th grade, leaving very early. Now they're able to go to grade 10. We've got areas where no women ever had any help in delivering their babies, and they now almost all have a nurse helping them. And there's one particular area that I like is where people were used to grow tobacco and they now grow vegetables instead through our work. Also in some areas people didn't used to have toilets, and there were huge numbers of diarrheal disease and malnutrition because of that, and that's changed. The numbers of people infected have gone down, so quite a lot of impressive change.
Great. And what kind of changes would you like to see in the future?
Well, again, as a small charity, we can't really achieve the change that Nepal really needs, which actually in a way is mainly infrastructure and using the hydropower potential they have. But our goal is basically to spread our area of influence, so geographic area of influence, and to make sure that where we work, there's no child dying because it has no access to health services from things like diarrhea, no child dying from malnutrition because there's just not enough food in the area, and also that all children go to school up to a certain level at least. Those are sort of our main targets. It goes without saying that it also includes all mothers having support during pregnancy and childbirth.
Fantastic, yes. So you mentioned the whole group of Phase began with volunteers. Are you still looking for volunteers?
Yes, definitely. We now have one paid member of staff, our director, and we are recruiting for somebody else, but actually the work in this country would not run without volunteers at all. We have lots of volunteers handling the communications and also helping with all the events that we run. So there's constant need for that side of things. We do also have a volunteering program in Nepal, but that is really for people with skills. So mostly it's GPs and teachers that come to Nepal and help our team there.
Great. So if somebody was considering volunteering, how can they get in touch?
So the best way to get in touch is to look at the website, which is very simply phaseworldwide.org. So obviously Phase with PHASE and then worldwide, all one word. And then there's a contact us page, and they could get in touch with Sarah, our director, directly with that. That's the easiest.
Great. Or come along on Saturday to the conference.
That would be great.
That would be a good start, wouldn't it?
Yeah.
Great.
Which is where again?
It's at the Burton Street Foundation in Burton Street in Hillsborough, and it starts at 10 o'clock on Saturday. But we do need pre-registrations.
And can they do that through the website?
Yes,
Yeah.
yes, definitely.
Yeah, sounds like a great day.
Now I had one question. So you sort of said how much has been achieved. How much do you think can be achieved in the next, I don't know, say 10 years, or how far do you think you're likely to go towards your goals?
Yeah, so our ambition is that we, so currently we work in something like 20 communities, which covers probably about 50,000 people. And our goal would be to at least double that area of influence and to make sure that in those areas people have enough to eat, children go to school, and women have access to healthcare. That includes, of course, men also having access to healthcare, because what we put in is general healthcare services. So that's what we are sort of aiming for.
Pretty huge, but doable.
Yes,